Assalamu alaikum, my lovely nurses. I hope you are fine. So today our topic is cluster B, types of personality disorders. So last time we did cluster A, types of personality disorders. Today our topic is cluster B, types of personality disorders. So what is cluster B, types of personality disorders? Is include dramatic, emotional and erratic types. So what's the types of cluster B personality disorders? There are four types. The first type is histrionic. Number 2 is narcissistic. Number 3 is antisocial. Number 4 is borderline. So cluster B personality disorders has four types: histrionic, narcissistic, antisocial and borderline. Now we will discuss one by one. So number 1 type is histrionic personality disorders. What is histrionic personality disorders? Is characterized by overly dramatic and intensely expressive behavior. So histrionic personality disorder are characterized by overly dramatic and intensely expressive behavior. This is the definition of histrionic personality disorders. Now what happened in this one? What's the behavior of the patient? Number A, we will discuss lively and dramatic and enjoy being the center of attention Number B, has poor and shallow interpersonal relationship. Number C, may be sexually seductive or provocative. Number D, dramatize personal life and may appear theatrical. Dramatize personal life. Overly concerned with appearance. The patient is overly concerned for his appearance. Easily bored. So this is histrionic personality disorder characterized by overly dramatic and intensely expressive behavior. These all problems are happening with this type of patient. The second is narcissistic personality disorder. Is characterized by an increased sense of self-importance. self-importance, and a preoccupation with fantastic and unlimited success. So narcissistic personality disorder is characterized by an increased sense of self-importance and a preoccupation with fantastic and unlimited success. So what happened in the narcissistic? Number A, fragile self-esteem, self-importance, need for admiration, and inflation of accomplishment, So he always needs someone will admire and inflate of accomplishment. Number C, overestimation of abilities. Overestimation of abilities. And underestimation, mean the patient is overestimation of his abilities and underestimation of contribution of others. Number D, lack of empathy and sensitivity to need of others, This is the narcissistic personality disorder. So number 3, antisocial personality disorder. The antisocial personality disorder characterized by the pattern of irresponsible and antisocial behavior. Selfishness and inability to maintain lasting relationship and inability to maintain lasting relationship, poor sexual adjustment, a failure to accept social norms, and a tendency towards irritability and aggressiveness. So antisocial personality disorder, a pattern of irresponsible and antisocial behavior, selfishness and inability to maintain lasting relationships, poor sexual adjustments, a failure to accept social norms, and a tendency towards irritability and aggressiveness. So now, what problems patient is facing in antisocial personality disorders? Number A, perceive the world as hostile. Number B, lack of empathy lack of empathy or feeling of remorse. Number C, egocentrism. What is egocentrism? Focused on personal gratification. Focused on personal gratification. Deceitful and manipulative. Irresponsible. Impulsive and engage in risk-taking behavior. Impulsive and engage in risk-taking behavior. The next is persistent or frequent feeling of anger. The anger. Persistent and frequent feeling of anger. Refusal to conform to social rules. Refusal to conform to social rules and normative behavior. The behavior is not normal. He is refusing to social rules. The last four is borderline personality disorder. So borderline personality disorder is characterized by instability in interpersonal relationship. In interpersonal relationship. Unstable mood and self-image. Unstable mood and self-image. And impulsive and unpredictable behavior. Impulsive and unpredictable. You cannot predict. Unpredictable behavior. That is borderline personality disorder. Now, what happened with the patients of borderline personality disorders? The poor self-regard, or unstable self-image. Unstable self-image. The next is unstable and intense personal relationship. Unstable and intense personal relationship. Lack of empathy. Lack of empathy towards the needs and feelings of others. And the feelings of others. Extreme shift in mood. The mood changings. Impulsive. Self-damaging behavior. Self-damaging behavior. Such as, for example, cutting, using some self-damaging, the self-hurting. Engage in risk-taking behavior. Engage in risk-taking behaviors. Manipulation. Intense feeling of anxiety. Intense feeling of anxiety. in response to stress. In response to stress. Chronic feeling of emptiness. Chronic feeling of emptiness. And intense fear of being rejected. And intense feeling of being rejected. Splitting. What is splitting? Sees others as all good. Sees others as all good or all bad. Or all bad. Mean they create conflict between individuals by playing one person against another. So he is confused. The patient of borderline personality disorders. He cannot, he always have conflicts between individuals. So this is the types of cluster B personality disorders. I hope you like the lecture, 4 types. So if you have any query, you can leave a message in the comment. And thank you very much. Please, if you like my video, share and subscribe and like, and don't forget to push the bell button to receive my coming videos notification. Thank you very much. Take care yourself and family. Allah Hafiz.